All right. Well, let's bring them out, the people you've been waiting for. First, editor-in-chief of the Daily Wire and host of the Ben Shapiro Show, Ben Shapiro. All right. And founder and host of the Young Turks, Cenk Uygur.
So that's how you say his name. Put it on the pound, Cenk.
If you guys can be a little more excited, that'd be great. All right, well, we're here to debate the future of the political parties. And let me just say quickly one thing about the format. I'm going to pose questions to both of our speakers here. We'll have a response. We can have a re-response. We can go back and forth a few times.
Ooh, are they not doing an intro? I really like this format, if so.
When we've gone far enough, then I will step in. I might ask a follow-up question, or I might switch the topic. So, are we ready to go, guys?
I'm ready.
All right, well, let's start with one of the topics in the news today, and that's healthcare. And I'm going to start with Ben. Are you proud or disappointed in establishment GOP figures like John McCain, Lisa Murkowski, and Susan Collins for their vote on healthcare?
So I'm wildly disappointed with the entire party. The fact is that we were promised a full repeal of Obamacare. They did not even attempt to pursue a full repeal of Obamacare.
Yeah, I'm with Ben Shapiro here. I don't think Obamacare is the right approach. What I favor is more of a free market in healthcare, so getting government out of the way, eliminating regulations, and making market reforms. Not Obamacare, where you get rid of the pre-existing conditions, which that just doesn't make sense within a system of insurance. It's like buying insurance for your house when it's already on fire. The whole concept of insurance is you pay into it before you get the disaster striking. That's how people can collectively pool risk. I think that there's a lot of unfair criticisms of the American healthcare system. Not that it's perfect, but there's a lot of propaganda attacking it, when in reality it is a pretty strong system.
And the fact of the matter is that there's a significant gap inside the Republican Party about whether this should even happen or not. There are people who believe that the Obamacare regulations are an affirmative good. There was an attempt to basically leave all the Obamacare regulations in place and just remove the fund.
I mean, this is not a surprise. The GOP has not been the party of limited government for quite a long time, since the old right, since Howard Buffett, since opposition to the New Deal. The GOP has always been another wing of social democracy. Even under the vaunted Ronald Reagan, there was wild expansion in the size and scope of the state, wild expansion in the Department of Education, in government spending. So it's not a surprise that part of the Republican establishment supported Obamacare. Mitt Romney had his own version of Obamacare in Massachusetts. So why would we be surprised that the Republicans supported that policy? It's completely in line with their ideological bent. which is neoconservatism, big government, spend, spend, spend.
Funding mechanism, which would have led to the exacerbation of the death spiral. The truth about healthcare is this. There are three qualities of healthcare that you can have. You can have affordability, you can have universality, or you can have quality. And you can have two of those three things, but not all three. Right? You can have universality, affordability, or quality. Two of those three things you can have. And one of the things that's happened with Obamacare is that you've gotten closer.
That's cute, but I don't know if it's true. I mean, the Swiss system, I guess it's expensive. I think if you had like just a genuine free market in healthcare, it would be universal, not universally egalitarian, not equal access for everybody, but everyone would have some certain level of access, and it would be affordable and it would be high quality. And this is the way that healthcare was in the States. At one point, like back in the 1950s or whenever. Before the whole system got so overregulated, and now the problem is that somebody else is always footing the bill. So it'd be better if people paid directly for routine care and then had insurance for catastrophic care. And part of the problem was just that healthcare is expensive. There's a lot of technology, a lot of salaries. There are some other issues like the AMA restricting the supply of doctors, which drives up the price. So there are some pro-market reforms that can be made to change the system, but I don't think Obamacare is the right answer. I think that's a step in the wrong direction, a step towards more government regulation. And ultimately, if the costs are going down for some people, like people with pre-existing conditions, well, that cost is being borne somewhere else. That money doesn't come out of thin air. The government has no wealth but what it takes from somebody else. So you're just changing who pays, but you're not getting anything.
To universality, but you haven't gotten any closer to either affordability or quality. And the Republican Party seems to be falling into the trap of basically just copying what the Democrats do, except being worse at it. What they actually need to do is relieve the regulatory burden that is driving up the cost of healthcare, and they need to stop acting as though insurance companies' jobs is actually just to reimburse people for their bad health. If you join up with an insurance company and your health sucks to begin with, you are going to pay more because it's an insurance company, not a charity. Now, that doesn't mean that we can't have...
In fact, that's a key aspect of insurance, is that it allows you to quantify risk. You can see, if you're smoking, if you're overweight, if you're engaged in sort of risky behavior, then your premiums are going to go up. So it can actually help you identify risk, and then it can be in your financial interest to help reduce or eliminate risk.
Now, that doesn't mean that we can't have some form of backup for people who have pre-existing conditions. I would hope that the social fabric would help fill that in. This is why I'm a big believer in charity and churches and synagogues filling that gap. But what we can't do is suggest...
And I agree, and I think that is what happens naturally. Nock wrote about how the expanse of state power saps social power. So when the government has programs like Medicare and Medicaid, and they're levying these confiscatory tax rates on the public to pay for them, there's not much incentive for people to try to solve these problems themselves through charity, because they've already paid the taxes and the government sort of monopolized it and taken over. So they just stand back and let the government do it. But absent that state control in that area, then you would see people taking initiative. You would see the exercise of social power to handle the needs of the people that are left behind. And this sort of charity and aid is much better than state charity, because it's targeted and tends to get the most value for your buck. When you have welfare programs, then they're pretty much open for anybody, regardless of, say, if they're spending all their money on alcohol and drinking themselves to an early grave, whereas private charity can be targeted to people who are poor, like single mothers who have to look after their children, can't necessarily work, as opposed to somebody who's poor because they make terrible decisions drinking and they don't want to work. I mean, these are two different categories of need, one which it makes sense to subsidize, and one which, in fact, you're doing both the individual and the taxpayer a disservice by subsidizing that self-destructive lifestyle.
As the Bernie Sanders left does, that health care is an inalienable right, and therefore you can put a gun to my wife's head, she's a doctor, and you can force her to provide care at any cost you want to pay. You can't do that and hope to increase the supply of health care. Health insurance is not health care. They're not the same thing. And anybody who tells you differently is lying or trying to sell you something.
Absolutely. Great point from Shapiro. Any sort of positive right that involves the labor of others or their service, you don't have a right to somebody else's labor. Okay, if you want, if a doctor spends 8 years or longer studying medicine and then working as an intern, I mean, this is an incredible devotion of time and energy, and absolutely they deserve to get paid for their services. And it doesn't help matters if you say, okay, well, we're not coercing the doctor, we're going to coerce the taxpayer. Well, it's no different, they don't deserve to be coerced either. People deserve to retain the totality of their productive efforts and accept what they want to exchange with others voluntarily.
Excellent.
I'm quite curious to see if Cenk rebuts that point.
Cenk, your take on the healthcare vote.
Great. Before I do that, first of all, welcome to the Thunderdome.
All right. Let's hear him speak.
Yes.
All
Guys,
right.
wait till he does something. I mean,
In all seriousness, the reason that I kid around about that is that I really want to make sure that Ben's opinions are heard and my opinions are heard, and that there's an exchange of ideas. And believe it or not, there are some things that we do agree on, but we won't be discussing those tonight. So on the issue of healthcare, let's get going. So the Democratic Party is incredibly proud that they defeated a bill that had 17% approval rating. It's a low bar, and I'm glad they held. The Republicans have a comical position, which is that why didn't the Democrats help us defeat Obamacare? Well, that's kind of because that was their idea, and why in God's green earth would they help you defeat their own plan? Now, is Obamacare enough? Not nearly. And there are a number of issues that we had as progressives with it, including lack of price controls. You left it in the hands of private insurance, and of course, them being...
Price controls are not a good idea. Certainly not in a free market situation. So there are some situations where price controls might work. For example, if you have a government granted monopoly privilege for a firm, and they're able to charge the so-called monopoly price, then price controls can work because the price is already artificially distorted. Like normally in a market, you have supply and demand, and there's a sort of equilibrium price where the market clears, where quantity supplied equals quantity demanded, and that's the tendency towards the markets is to go towards that price. So But so if you have a free market where there's no intervention, no government intervention, no grant of monopoly privilege, then imposing price controls is only going to lead to shortages or surpluses, which in the case of healthcare can be a big problem. Actually, that's a problem that we face in Canada, is because in Canada, what we have is socialized medical insurance. So the doctors are all nominally private, most of them operating out of their own practices or hospitals, which are run on the basis of a non-profit. Although there's still a lot of profit being made by, administrators and execs and whatnot. Although, counterpoint to that being, hospitals are large, expensive organizations, so it makes sense to have premium talent at the top, making sure everything's working smoothly. But I digress. The system in Canada, socialized medical insurance. So the prices are all set by the state, and then the doctors are all sort of private. They have their own operations, their own offices, practices, but the government pays for everything. And that's the case across Canada. There's some different implementations, but that's the basic gist of it. So, because the government's setting prices, that's the same thing as price controls. That's what it's a very rigid price control. Instead of a price flooring or a price ceiling, it's both. And so, because of that, we end up with shortages. Even the Supreme Court of Canada has acknowledged that the estimates are in the thousands to 10,000s per year. People die waiting to see specialists, waiting to get MRIs. There's a really bad problem. So Canada has some of the worst results for healthcare among OECD nations. First in objective measurements like hospital beds per 100,000 and doctors per 100,000. Obviously, some of the stuff like quality of care is not necessarily that easy to measure. But if you look at ER bounce rates, they're substantially higher in Canada. That is, people that go to the ER and then don't get treated and just leave. And waiting times in particular can be excruciatingly bad because, that's something that you need a price system to address. In a price system, when you have a scarcity, then the price goes up until you get more of that service. But because prices are fixed, that doesn't happen. So a lot of people end up waiting a long time to see specialists. Many of them die. Many of them seek treatment in other countries.
Corporations, which Ben kind of alluded to there, they're going to want to make money. And so that is very, very normal. And so I don't...
This is a common leftist fallacy. They think that businesses can just arbitrarily set their own prices, and if they have the economic power, they can bully everyone into paying that. That's not how prices work. The price of a good or a homogeneous good or service is determined by supply and demand. So it's not just companies saying we want to make more money, we're going to raise the price. Of course they want to make more money. Everybody wants to make more money. We're all perfectly greedy. That doesn't mean that supply and demand doesn't exist. So they're not able to unilaterally dictate terms to the market, but instead must price based on market conditions.
I don't think that was the right way to approach it, and it was originally a Heritage Foundation plan to begin with. So I believe that the right approach, and the one that Democrats should pursue next, although they probably won't, is Medicare for all.
Boo earns.
So So real quick, let me explain why. Medicare polls at 77% and actually accomplishes the three things that Ben talked about. It's universal coverage, it is affordable, and actually gives you good insurance. That's why it polls at 77%. And Medicare for All now polling at 60%. Federally funded health insurance for everybody polling at 61%.
How well a policy polls is not really a good argument for it. The Mercatus organization did a study which showed that Medicaid for All would cost about $3 trillion per year, and would increase federal healthcare commitments to 10% of GDP, which is just a staggering figure. And then you also have to factor in increased demand. And I guess advocates of the proposal might say this is a benefit in that, because as the cost goes down, the quantity demanded increases. So that's going to increase the total cost of the program. How are you going to fund this? $3 trillion is an enormous amount of the federal budget. And this was back in 2019, 2020 for Bernie Sanders' plan. So now that we're in 2023, we're talking about an even bigger figure, and you would need to impose some massive taxes if you wanted to finance this without going into further debt. Maybe a very large sales tax, or it's hard to imagine how you could raise that much money in taxes in order to pay for this program.
My Democratic friends, you might want to try something that's popular for a change. So, and finally, on the idea that, hey, listen, everybody can't get health care. Well, this is not like furniture, which sometimes you allude to, Ben. You could have good furniture, bad furniture. I've had it all, right? That's optional. If you don't have good health care, you die. And so I view it as not something that capitalism should deal with, and I believe in capitalism, and I think they make great sneakers, but something that is about equality of opportunity. And you cannot have equality of opportunity if you're dead. So Medicare for all.
Okay.
Go ahead.
So a couple of notes in response to the Medicare for All shtick. So this is Bernie Sanders shtick, obviously. The problem with Medicare for All is that when people say that it's affordable, this isn't affordable to the person who has the Medicare. It is not affordable to the country. In fact, it is so unaffordable to the country that the state of California was a nut job leftist state, just refused to even pass Medicare for All because it would have immediately doubled the debt.
And California's got a lot of debt. Not as much as Ontario.
As far as the idea that medical care is a right, but it's not actually a good or a service, this is a way to make things less plentiful. If you declare things rights, but you don't actually incentivize the creation of those things, you don't get more of them. So the South African Constitution has right in there that healthcare is a right, that housing is a right. The fact is that you don't have good housing or healthcare in South Africa because just declaring things rights does not make them appear. What makes
That's why you can call these things paper rights, where governments, dictatorships around the world say that citizens have the right to free speech, all these rights. It's in the constitution of the Soviet Union and Communist China. Everybody has all these rights, right to a free society, but it's not worth the paper it's written on.
more things appear is a market-based system that creates more doctors, that creates more medical care, that creates more incentive for people to join up. So my wife is a doctor. That means she has to go through 1,000 years of medical training, and we have to spend hundreds of thousands of dollars to make her a doctor. The idea that you're going to have the government come in and then dictate the sort of care that she should provide to each particular patient, and then dictate how much she should be paid for that care, is going to lead to a decrease in the number of people who are going into the medical industry, which decreases the level of care overall. This is why I say that it is better to treat things as goods than as rights, because declaring something a right just means that you have the right to steal it from me. But declaring something a good means that you get a market process that leads to lower prices and better care over time. And the big problem we've had before Obamacare is that it was already treated quasi as a right. You had it heavily regulated on the state level. It is continually heavily regulated. The idea there's a completely unregulated market is absolute nonsense. The reason that you have employer-based health insurance in the first place was as a response to wage and price controls placed in the aftermath of World War II, and employers began giving health insurance as an actual good, right? They gave it as an actual incentive to their employees. If you had an actual individual-based health insurance market, you bought it just like you bought your car insurance, you would see more and better health care for everyone.
Yep.
The Swiss have a great model of healthcare, which is it's a fully market-based system done through insurance, and there's very high levels of consumer spending on healthcare because they're a very rich and old nation, so it makes sense. And there's a lot of different insurance plans and coverage. But it's a very market-oriented system and delivers incredible results. But it does cost a lot of money. But that's paid by consumers, not the state. There are some subsidies for low-income individuals so that you achieve universal access even within the market spectrum, which is a nice compromise.
All right. So, Ben, I don't want to steal health insurance from you. I want you to be healthy. That's why I want Medicare for all.
You just want to take my money and my wife's services.
So, Republicans frame taxes as stealing. That's preposterous. So if we don't have tax...
It's not preposterous. It's exactly what it is. Taxation is extortion. That's why you throw the people in jail if they don't pay. That's the coercion. That's the force right there. It's criminal.
Taxes. If we don't have taxes, well, we can't do all the things that we want to do as a community. Now, there are some things that we just talked about that we don't want to do as a community, we want to do as individuals. In fact, the things that we want to do as individuals are much greater. That's why we're a mixed economy, but largely capitalist. And I agree with that. And I run a small business myself, getting larger every day. So, but there are some things that the government should do. They should do the military, cops, roads, bridges, and yes, education and healthcare. That's because,
I disagree. If the government is superior at providing housing and food, doing agriculture, if the market is superior at all these things, at producing goods, then why stop there? Why not allow the market to be superior at producing education and healthcare and even, yes, roads? Government monopolies are inherently inefficient. There's no mechanism to ensure efficiency. So if you have competing firms providing services to the public, then the public is going to choose the one that's doing the better job most of the time anyway. Almost all the time, their money's on the line, and they can evaluate if they're getting good service. So, especially schools, the public school system is a horrible, abject failure. And what you have is a monolithic, one-size-fits-all solution when what you really need is innovation and experimentation and try different teaching methods. There's a lot of ways we can improve upon the present school system, which is highly bureaucratic, which is extremely expensive, and frankly does not do a very good job of educating our children. So absolutely, the market economy can do better than the state for the same reason that we have the market economy do most of the things that we need.
Conservatives seem a little confused about how healthcare works. Paul Ryan had a whole press conference about this. Ben a little bit alluded to it there. They're like, oh my God, it turns out the healthy subsidize the sick. Yeah, that's insurance. That's how it works. It's like...
Yeah, but if you're already sick, then you can't get insurance, so you pay extremely high premiums. That's how it works.
The people with that...
Does this guy think that insurance is inherently redistributive?
are not getting into accidents are subsidizing the accidents. Yes, that's car insurance.
And you're not allowed to sign up for your car insurance after your car's been run off the road.
That's how insurance works. And yes, taxes work in that we all decide we're going to do X, but we're not going to do Y. And
we don't all decide. A tiny fraction of the population, the political elite, decide, and the rest of us live with that decision. It's not a collective decision. We don't have direct democracy. We don't log on to a website and vote every day. A tiny political elite decides what they're going to spend our money on, and surprisingly enough, it's not stuff that we want most of the time. It's stuff that will further their careers and further their agendas and make them wealthier, but it's not stuff that's good for the public, which is why they have to use force to collect the money to finance this whole scheme in the first place.
And I think it is fair for society to say that, yes, we are going to do health care for everybody. Everybody. We're not going to leave 20 million people uninsured. We're not.
I think that's a reasonable goal, that everybody should have at least some basic level of health care. That doesn't mean you need Medicaid for all or socialized medicine. You can absolutely achieve universal access to at least a basic level through a market system, either through charity or through charity, through the doctors themselves. They're not going to want to let a sick person walk out of the hospital. But at the same time, I don't think it's reasonable to say that, someone who's drinking their life away and is indigent because of that should get the same level of care as a highly productive member of society who works hard every day. Maybe they're a skilled professional, maybe they're a small business owner, maybe they're a line cook in a restaurant that really banks up the overtime. They have the money, they can afford a higher standard of care, they're willing to pay for it. Then I don't see why we have to treat them exactly the same as somebody who's wasting their life, who's making terrible decisions, at least with regards to their health, and then society's got to bail them out. There should be an element of personal responsibility here in terms of how many resources are allocated to you based on your decisions.
We're not going to leave 30 million people uninsured. That's not what we do in a civilized society.
And he says 30 million people uninsured. That doesn't mean they don't have access to health care, right? They're just uninsured. So being insured is not necessarily the same thing. There's free clinics. If you have an emergency, you can just go to the hospital. They'll still patch you up even if you can't pay. So it's a little disingenuous. He's implying they don't have any health care just because they don't have insurance. That's not necessarily the same thing.
And from time to time,
and a lot of those 30 million choose not to be insured. They're young, they're healthy, it's a risk, and they take it. So it's not that they can't afford the insurance, it's that they forego it, in part because they know perhaps that the state will pick up the tab anyway.
The attack against Medicare, they say, oh, it's an entitlement. Yeah.
Or they can just default on the medical debt.
We paid for it through payroll taxes our whole lives. You're goddamn right we're entitled to it because we paid for it. We paid for it. And so when you take out the middlemen of the insurance companies that put their profits in there, that put their marketing in there, that put their lobbyist money in there, that means more savings for Americans. And
Sure, take out the insurance companies and replace them with a massive government bureaucracy. Which do you think is going to drive up the prices more? And insurance plays a vital role in helping individuals to determine risk and pooling risk collectively.
so finally, the idea that it can't be done is preposterous, since every other Western developed country does some version of single payer. It obviously can be done.
Really? Just Switzerland?
And it is done at lower rates and better coverage.
So let me add something to this question, and you can respond to it if you want to, but Cenk referenced Paul Ryan. When the Republicans took control of Congress, Paul Ryan, the Speaker of the House, famously said, we need to switch from being an opposition party to being a proposition party. So what's your evaluation, Ben, of their efforts in that direction to unite the party and move legislation forward?
I mean, we all have eyes. They suck at it. I mean, and Paul Ryan is not exactly my go-to guy when it comes to political acumen and genius. So I'd more want to respond to some of the contentions that Cenk was making about Medicare for all and single-payer health care. A couple of things. One, when you say we pay for it, that's not technically true. The idea that everybody who's paying into Medicaid paid for it and now they get out what they paid in is obviously not true. It is a redistributive program, and to pretend otherwise is just silly. The people who are paying the payroll tax...
Not to mention, the payroll taxes you've paid won't come close to covering the expense of Medicaid for all, $3 trillion a year. I don't care how many payroll taxes you're paying. You're not, that amount of money is not being raised.
Taxes are not the people who are taking out through Medicaid, obviously.
Can I just address that super quick? So if we're talking about Medicare, right? Not Medicaid.
Right.
So in Medicare, so you're both correct and incorrect. So it's not like I put in $20 and I get $20 back. That part is true.
Right.
But we all pay into Medicare together, and then we all get it when we are
Can
sick.
I ask you,
which is
a
insurance.
question? I have two questions, really serious questions. One, what is your ideal tax rate? Because it's going to cost a lot of money for a lot of this stuff. And two, what is your ideal level of medical care? Because the fact is that we can spend millions of dollars on people at end of life care. We can spend millions of dollars on surgeries and preventative care. I mean, healthcare is an expensive business, even under a single payer system, which is why generally you end up with rationing. So what is your ideal level of healthcare that is provided to everyone, and what sort of tax rate are you proposing to subsidize that?
Yeah, so those are very, very fair questions. So let's talk about taxes for a second. So conservatives agree or say all the time that the golden era of America was the 1950s and 1960s. Well, there's a lot of truth to that. Our economy was booming at the time, and
I don't know. Personally, I'm more of a Gilded Age kind of guy.
became the #1 economy in the world at that time. The tax rate for the highest bracket fluctuated between 70 and 91%. So that is when we were at our best. Now, I want to be clear. I'm also...
The income tax rate during the Gilded Age, 0%. There was no income tax.
businessman, and boy, that seems high. It does, okay? And one of the reasons my family were Republicans when I was growing up was because before Reagan came in, the highest marginal tax rate was 70%.
So it's true that the total tax receipts, the top marginal rate was 90% in 1950. But if you look at total tax receipts as a percentage of GDP, you see that the government wasn't really collecting a lot more money back then relative to total income in the economy. And even if you look at income tax receipts as a percentage of GDP, it's not like that's much different. It's not like the money was coming from different tax rate or different tax or tariffs. So how come with a 90% tax rate, the total tax revenues didn't change? Well, there's a number of things. In the 50s, there was 24 total tax brackets. So the very, very top rate was very high, but few people were earning that much. And there was also a lot of deductions and write-offs and widespread tax cheating. People just cheated on their taxes, refused to pay them, used all these fake deductions, whatever. So a lot of these deductions were eliminated in the 1980s while the taxes were being cut, the famous Reagan tax cuts, which actually were sort of a bit of a wash, as you can see in this, the total tax receipts didn't really go down during that time period. It was maybe a tiny bit, insignificant little drop, but nothing out of touch with what the government has been taking throughout the 20th century. So it wasn't really, tax policy wasn't really any different. Not many people paid those, almost nobody paid that top rate. People would put money into corporations. They would have a lot of write-offs. People just didn't earn that much back then. So it's not like the whole system of taxation was radically different back then.
Nowhere near that. We have reduced taxes to bare bones, and we have shifted the taxes onto the middle class and away from the rich and corporations.
That's also untrue. Actually, the highest income earners are paying a higher percentage of the total tax share now than they were in the 50s.
So there is a much better balance to be had. And if you said to me, well, you're going to have $800 in taxes that are new, I say, wow, that hurts. But you're going to save $1,000 in premiums, deal. That is a deal I will take every time because I can do math.
Okay.
So that is the beginning of your answer to taxes. And then you said how much care. Well, so that is something that all the countries that do single payer or a version of single payer struggle with, and they have learned a lot of lessons. And if we stop saying, America's number one, we might actually just, first of all, on this issue, we're number 37.
So,
and if
Number 37? Are you kidding me? So this 37 ranking does come from the World Health Organization, but they're not really measuring the quality of healthcare, but subjective things like fairness or how much you pay out of pocket. So is there a World Health Organization study that ranks America as 37th? Yes, but it's seen through a lens of an organization that's fundamentally in favor of single-payer medicine, and that's one of the metrics. Do you have single-payer medicine that they're ranking on? Fairness, how much you pay out of pocket. So if you're simply talking about sort of the results of patients, then no, America is ranked much, much higher than 37th. It's not true to say they're 37th. The quality of healthcare is on par with Slovenia. But these are studies made by people with a political agenda to promote socialized medicine, and they're biased as a result.
If we looked at what Japan is doing so well, keeping costs down to half of ours and less, we might actually learn something from Japan, Switzerland, and other countries. And by the way, when we say Medicare for all, Medicare Advantage exists. So you can actually add private insurance on top of that, and I find that perfectly great. I have no problems with that at all. So that is the government making sure you don't die and actually lowering rates for you. And then if you want more insurance, no problem.
So all this sounds great, except for the fact that Medicare, Medicaid, and Social Security eat up 66% of the federal budget every single year. The idea that all of these socialized medicine countries have it so much better than we do, particularly in terms of cancer care, is a joke. We are still number one in terms of 5-year cancer survival rate here in the United States. And when you talk about top marginal tax rates in the 1950s, There are a couple things that are worth noting. One, that was top individual marginal tax rates, not necessarily the business tax rate. We now have some of the highest corporate tax rates altogether in the industrialized world. And if you would prefer for us to destroy half of the world before we become the only country that didn't have its industrial capacity destroyed, which is what happened in the 1940s, leading to us being the only productive country on planet Earth, essentially, for the next 2 decades, I'm not with you there. I'm not really in favor of having a giant world war that destroys all
Only productive country in the world? I'm not sure I believe that.
industrial capacity across
What about Canada? We exist, we matter.
the West, so we're the only people who actually have the capacity to produce anything and just markets that we can provide to.
Right. So, first of all, it is fair to say that, of course, the 1950s and 60s were different. We'd just come out of the war. So, but you have to consider all the different factors. So one was that factor, and the other factor that was the one I mentioned. So when Republicans or conservatives say, well, high taxes by definition will lead to slower growth, well, we know because of our experience in the 1950s and 60s that isn't true. Now, you can say there are other factors.
Except, judged by total tax receipts, as a percentage of GDP, taxes weren't higher. They were about the same.
But you can't say that the highest marginal tax rate being 70 or even 90% slows down growth, because it didn't. And it wasn't in Japan and Switzerland, it was right here. And so
It's not important what the highest marginal tax rate was. What's important is what is the overall tax burden. In fact, what's really important is what is the overall level of government spending, because it doesn't matter if you're paying in taxes directly, or you're running a deficit, or you're trying to print the money. All government spending needs to be paid for. So really, it's aggregate government spending that you want to look at when determining the cost of government to the economy. So this is a shell game that's played in politics. You know, they're focusing on one narrow thing, the highest marginal tax rate, without looking at the bigger picture.
And by the way, as a guy who grew up Republican, I was surprised by that too. I was surprised that Finland's system of non-competition in schools worked, but it does. So we have to be open to facts and understand. So, and on the issue of where we're good and not good in healthcare, sure, there are different areas where we excel. But Ben, honestly, you're cherry picking there, one particular area that we're good. Overall, we're number 37. That is not a good result.
There's a lot of areas where America has superior results
Well, you have to break.
in healthcare.
We're not
what that
dying
means.
from cancer, we're dying from the other things. It's empirical. We are.
No, it's not empirical. That study doesn't simply measure healthcare outcomes. It's an evaluation of the system as a whole based upon the criteria of fairness, egalitarianism, how much people are paying. So these are he's not mentioning that. He's not bringing that up.
Are not as healthy. And finally,
another thing too is that going into the healthcare system, Americans aren't necessarily the same as the Dutch or the Japanese. You know, obesity rates are much higher. There's more issues with heart disease. So even if the population is less healthy, it's not necessarily the healthcare system, but rather the overall diet or activity. I mean, it's diseases of prosperity. You know, they're too rich. It's too easy to obtain calories these days. Don't I know it?
And finally, this idea that corporations are paying the highest tax rate is both, again, true and untrue. The part that it's true is, hey, there's a rate of 35%. The part that's not true is
corporate taxes are an unfair form of double taxation anyway, because that money is going to get taxed and it's taken out of the corporation and paid to the workers or the shareholders as income. So all this does is encourage alternative, less efficient forms of enterprise. Really, the best thing to do is eliminate the corporate tax rate. Corporations are great. Love corporations.
They don't actually pay that. There is giant loopholes. And they've got $2 trillion sitting offshore.
First of all, we should be happy that that corporations and individuals are able to escape some of the confiscatory tax rates that demagogues have advocated for a long time. We already have way too much government. The last thing we want is even more. But usually these loopholes are things like reinvesting in the business, writing off depreciating capital. So it's not that they're getting away with anything. They're doing what you want them to do, which is to reinvest and build the economy, create more jobs, create more prosperity.
And they won't bring it in. And the reality is that if you look at the taxes from the 1950s, corporations used to pay about a third of our taxes, about 33% of the taxes overall. So they did their fair share, and that is fair. I don't want them paying all of it, but I want them paying a reasonable amount. Now, the share that corporations pay of taxes is down to 10%. You see what they did there? They did wealth redistribution. They took your...
I mean, you saw the chart I showed earlier of income tax receipts. It's been about the same as a percentage of GDP. So the government's getting about the same amount as they always have from the income of individuals.
Wealth and redistribute it to them.
Okay.
Also, a tax cut is not wealth redistribution. It's quite the opposite. It's wealth not being redistributed.
Ben, I'll let you respond to that.
Yeah, one more quick point, and then I'll be done.
Although kudos to Cenk for throwing the redistribution bomb back at the GOP, even if it's not true.
With this, because we can do healthcare for 8 hours here. But two things. One, I'd like to know which tax deduction, when people say tax loopholes, a tax loophole is just a tax deduction that's available to everyone, and some people take advantage of it and some people don't. I can't take advantage of certain corporate tax deductions because my business isn't in those businesses, for example. I'm sort of with you in the sense that I'm not in favor of tax deductions. I'm in favor of a lower tax rate and get rid of a lot of the tax deductions.
I'm in favor of both. I would favor a lower tax rate. I would favor tax deductions. I view taxation as an invasion of property rights by the state against the individual or the corporation that is being forced to pay these taxes through coercion. So anyone getting a reduction in taxes for any reason, I'm in favor of. I don't buy into this logic that everybody has to pay the same rate in order to be fair. The fairest thing would be for everybody to pay zero, and the next fairest is to help anybody to lower their tax burden if possible. It also has the side benefit, or perhaps the primary benefit, of reducing government spending and starting to shrink the power of the state.
Deductions, because I think that it's ridiculous that we have people gaming the system. That said, I'd like to know which tax deductions you'd like to do away with. And I'd like to know also, when you say that corporations pay 10% of the taxes, right, and individuals pay the other 90%, okay, so that means the taxes are still getting paid to a higher rate than we ever have in our history in terms of the tax revenue to the government. The amount of tax revenue to the government right now is trillions of dollars every year. And final point here, you elided this question by saying we can learn stuff from Japan.
Is he talking in real or nominal terms? As we saw, as a percentage of GDP, in real terms, I don't think tax revenues have gone up substantially. Obviously, in nominal terms, they're always going up because of inflation. And,
standard of care is the entire
and the economy growing.
Question when it comes to single-payer health care. That is the entire thing. If people felt like they were going to get the same access to care in a single-payer health care system as they did in a system where they can pay their own way, then we would have no controversy here. But the fact is that rationing is mandated as soon as you start having the government run the healthcare system and decide what level of care people get. So I don't want anyone deciding what level of care that I can get. I don't want anyone else to, they don't care about me. They don't know my child's name. They don't know my name. All they know is how much I cost. I mean, Ezekiel Emanuel is at least honest about this. Ezekiel Emanuel comes out and says, listen, I want to die at 70, right? I want to die at 80. That's fine with me. I'd rather die at that. Well, that's good for him. But if I don't want to die at 80, or I don't want my father to die at 80, that's none of his damn business.